Let's talk about some endocrine and reproductive anatomy. This sculpture from Renaissance times, I guess, reminds me of some of the parties I went to back in the 60s. Drugs may have been involved, I'm not sure. So, taking a look here, overview here. Kidneys, we already know about that. When we do reproductive anatomy, we've got to keep all the urinary stuff still in mind because a lot of it is in the same area of the body, and we need to make sure to distinguish reproductive structures from urinary structures, and in some cases they overlap one another. So we still have to know all that stuff. So the kidneys, the renal arteries, the renal veins, the ureters, the adrenal glands, the urethra, the ovaries, the uterus. Okay, so look at how the uterus sits right there on top of the bladder. That's why pregnant women, all those poor people, I mean, that damn little parasite sitting right on top of your bladder. That's why pregnant women have to pee all the time. And the adrenal glands, you remember, sitting right on top of the kidney. Adrenal, at the kidney. Okay, so a little overview here of female reproductive structures. The uterus. Notice how the uterus again sits right on top of the urinary bladder, all right? The urinary bladder right underneath the uterus. The vagina is the exit tube from the uterus, or the entry tube to the uterus. It works both ways, and that's how the little seeds get in, and that's how the little parasite gets out. So, external urethral orifice, this is right next to the vaginal orifice. So, look and see, the females have 3 openings down there. Notice the one that's northernmost, most anterior, if standing up. The external urethral orifice, then next would be the vaginal orifice, and then next would be the anus. So keep those 3 straight. It's important not to get those mixed up for a lot of reasons. Urethra, again, the tube leading from the bladder. So there's a simple overview of female. Now here an overview of male reproductive anatomy. So the prostate. Look at the urinary bladder. Immediately beneath it is the prostate. This is a special gland in males. Females don't have one of these. In a typical adult male, it's about the size of a walnut. And as males get older, it enlarges. Benign prostatic hyperplasia. It becomes like the size of a key lime. And then it presses on the bladder. And that's why old guys have to pee all the time as well. Then the urinary bladder, right, and the prostate, right next to each other. The penis, the external part of male reproductive anatomy. And then there are 3 segments of the urethra. Let's take a look at those. So notice from the urinary bladder, the urethra leaves the urinary bladder. It goes first through the prostate, where it's called the prostatic urethra. Then it goes through that where it says there deep muscles of the perineum. That part is called the membranous urethra. That tiny segment of the urethra right there is the membranous urethra. From then on, the urethra goes through the penis, and it's called the spongy or penile urethra. You can call it either one. Spongy is because it runs through tissue called the corpus spongiosum. So that's why it gets called the spongy urethra. The external urethral orifice at the tip of the penis. Then the testis and the scrotum. So testis, don't say testicle. I'll mark that wrong. Testicle is actually a name for several structures combined. It's not really a good anatomical term. Testis is the endocrine gland itself right there, the structure. So it's a testis, and it's inside of the scrotum, all right? Testis, scrotum, penis, external parts of male reproductive anatomy. Taking a look then at some endocrine things, the pineal, you learned about that in Bio 201. Remember, that's on the posterior side of the brainstem. It's right up there by the posterior commissure. Right above there, the superior and inferior colliculus. So on the back side of the brainstem. The hypothalamus, remember, brain tissue, they're the homeostatic control center of your body. Hypothalamus is underneath the thalamus. Hypothalamus, underneath the hypothalamus, also somewhat anterior to the thalamus. And then below the hypothalamus is the pituitary. Pituitary, it hangs down like an apple off of a tree, and the tree would be the hypothalamus. The thyroid gland up in your neck by the thyroid cartilage, which we already learned about. All right. The parathyroid glands are essentially 4 little dots on the backside of the thyroid. They're not visible from the front, they're only visible from a posterior view. Parathyroid glands, of course, producing parathyroid hormone, which you already know all about. Thymus, we already also know about. This was an organ of the lymphatic system. So it's where your T cells go to boot camp. Remember, T cells get trained. All your white blood cells are born in the red bone marrow. The B cells get homeschooled, whereas the T cells go to boot camp in the thymus. The adrenal glands, adrenal, at the kidney. They sit directly on top of the kidneys. Kidney, of course. Uterus, all right, in females, we saw that before, sitting on top of the urinary bladder. The ovaries and the testes are corresponding organs for male and female. Ovaries stay up inside the abdomen, pelvis, whereas the testes descend. The testes start internally and then they descend. In some cases, as we'll see, they don't descend. Cryptorchidism, and then normally they try to do something to get them to show their little faces and come out and say hi. Testes again, and the scrotum. All right, so just very basic external male and female reproductive structures, and then also all the endocrine structures as well. So now zooming in on the pituitary here, so we see the hypothalamus up there, a brain structure. Coming down from it is the pituitary, like an apple hanging from the tree. And then the stem that holds the apple onto the tree is called the infundibulum. The stem, the stalk, all right, you can see there. This is important because that's how hypothalamic hormones can travel down to the pituitary, through the infundibulum, right? The anterior pituitary and the posterior pituitary, these are really different from one another. So the anterior pituitary is sometimes called the adenohypophysis. It is an endocrine gland. It is really an endocrine structure. The posterior pituitary, sometimes called the neurohypophysis, is really a brain structure. It's neural tissue. It's really just an extension of the hypothalamus. So that's important in terms of the hormones that are released and in terms of how the hormones get there, all right? The hypophyseal portal veins are the veins whereby the hypothalamic hormones travel down to the anterior pituitary. The releasing and inhibiting hormones come through the hypophyseal portal veins. Portal, again, we've seen the hepatic portal vein. Portal means to carry, like when you have to port your canoe over land to get to where the lake or the stream picks up again. So these are veins that carry hormones from the hypothalamus down to the pituitary. Here we see then the thyroid gland, and the thyroid gland is composed of an isthmus and the lateral lobes. So you can see there are 2 lateral lobes, and then there's an isthmus in between. The isthmus is the connector, and you've seen that word before, the Isthmus of Panama, connecting North America and South America. An isthmus is a little narrow strip of land that joins 2 larger bodies. So here the isthmus of the thyroid joins the 2 lateral lobes. You also, of course, know it from the Christmas song, you know, I'm dreaming of a wide isthmus, just like the one in Panama. Yeah, I'm sure you've all sung that song before around the Christmas tree. So here, looking at a posterior view of the thyroid, we see the parathyroid glands. Thyroid, and then 4 little parathyroids. See the little green ones? Parathyroids on the posterior side of the thyroid. And again, very important because they release parathyroid hormone. So zooming in on the cells of the thyroid gland, we see there are thyroid follicles. The follicles are the big, whatever that color is, magenta structures. And then the follicular cells are the little black dots, okay? And then there are parafollicular cells, which are in between the follicles, all right? So check those out right now. So the big, giant magenta blobs are the follicles. Lining the follicles are the follicular cells, and then in between the follicles are the C cells or parafollicular cells. This is important because follicular cells are where thyroid hormone comes from. Parafollicular cells, or C cells, are C is for calcitonin. So notice we've now seen where all those three calcium hormones come from. Parathyroid hormone, calcitonin, and calcitriol. That's made, as we said before, by the skin, the kidney, and the liver. So we'll use this in the lab practical. I want you to know the follicles versus the follicular cells versus the parafollicular cells. And then here, looking at, again, just the adrenal glands. We have the kidneys, the adrenal glands sitting on the top, the renal arteries and the renal veins. You still have to know the arteries and veins. So we'll pick this up again in the second of the endocrine and reproductive anatomy PowerPoints.